And now a moment from Your History and Health Comes First with Dr. Richard Brown.
Welcome back. This is Dr. Richard Brown, and this is Your History and Health Comes First. Thank you for joining me again. Summer's about to get away from us. So it's important that we make sure we get all our summer things done. It's going to run into the winter, and then we'll have an excuse for not getting it done and all of that. So what I want to talk about today is a topic that affects every man, woman, and child in America. And it's not a popular topic usually. People don't think about it a whole lot until they have a problem or issue. And even when they know that they may need it, they don't want to do anything about it because for a lot of different reasons, mostly because it costs so much, and they just don't want to think about the fact that they might get sick. So the topic and the problem is uninsured in America. So many Americans are very unhappy with this healthcare delivery system because they believe that it's flawed. And from my perspective, it's true, it is flawed. Although Obamacare provided a partial solution to the system, it is still broken. Healthcare in this country is limited to either insured individuals, those who have health insurance, and those who have large amounts of money and cash available in case of a medical emergency. On the other hand, the uninsured Americans often go through a great deal of trouble, problems, issues before they can actually get treatment. So consequently, many of the United States population choose to postpone seeking medical treatment, whereas others are forced to go deep into medical debt. So when someone gets hurt, sometimes, especially in the poor and Black communities, we don't want to call the ambulance because we know that's going to cost some money. We don't want to go to the hospital because we know that's going to cost some money. So we're going to go get the Robitussin, or we're going to go get something to rub on it, or we're going to fill you up with some concoction that was used way back when, some of which works, but we don't want to go directly to the medical facility in the system because we know that it is an expensive system and it's going to cost us a lot of money. So what I want to do is highlight a few serious, crucial facts concerning this topic. And it's based upon an article I've read recently by Smila Janik Stasha. She writes for an organization called Policy Advice. So in 2020, how many people are uninsured? Well, there's a serious statistic about how many are uninsured, and it's about 27.5 million people. That's a lot of folk who are uninsured, people who, if they get sick or their children or relatives, parents get sick, that they don't have health insurance to go get care. So data from the US Census Bureau indicates that a total of 27.5 million, as I mentioned, Americans had no health insurance, and that's since 2018. Also, the number of American citizens who were uninsured in 2020 is now about 31 million. Now, this number is expected to increase significantly due to change in the mindset of the population. And that's the whole topic as to where our population's mind has been and is going these days. Secondly, the uninsured rate in this country from 2019 amounted to about 10%, actually 10%, almost 11%, which is up from about 10.4% the previous year. So it has been found that the health insurance is not owned by around 44 million adults in the United States, while 38 million or so do not have adequate health insurance. So the rate of the uninsured US citizens increased from 25.6 million in 2016 up to 27.5 million in 2017. And so the uninsured is going up, it is not going down. So what does a poor person or a person that's uninsured do when they need health care? Well, now as of 2010, we have the Affordable Care Act. That was made possible by the Obama administration, and they made sure that people who were on Medicaid, at least, were able to obtain health insurance through something called a marketplace coverage. And most of those people who are uninsured, they've got somebody working in the family. It's not like they're totally all unemployed and just don't have any means. There's people that are working, but they don't make enough money to pay all their bills and worry about healthcare. So they don't think about saving for healthcare, or they don't think about buying or purchasing healthcare, because in this country, healthcare insurance costs a lot of money and is way too high for what it should be. In comparison, Canada, who has a universal health insurance system, provides medical treatment and plans and exams and all the services that people need, and it's free of charge. It is purchased through the fact that they pay taxes, and so they make sure all their people are taken care of and have medical care. And out of the 37 million citizens that are insured in Canada, about 25 million Canadians have opted for even additional insurance. So when considering uninsured healthcare statistics, there's a huge discrepancy compared to the United States, where millions of people are having difficulty paying their yearly premiums. Now, the system is very complicated. You got to have premiums, there's deductibles, there's riders, there's this, there's that, there's all kind of changes depending on when you enroll and the ages of the individuals, whether you're male or female, whether you're a child, or it's just very complicated, and it shouldn't be. According to some of the statistics that are listed, we can easily conclude that the health insurance system in the United States is definitely flawed and is in need of reform. And all people just can't access, quality care. So when I was in graduate school, 30-something years ago, 35, 40 years ago, that was a major topic. That was back in 74, 75. The topic was health insurance a right, or was health insurance a privilege? And of course, I was of those that thought that it was a right, and many of my classmates thought that it was a privilege, which they wanted to agree with the teacher. I always thought it was a right, still think it's a right, and many people think it's a right. It should not be a privilege such that if you are privileged, then you can get health insurance. If you're not privileged, then you don't get health insurance, and many of your people die if you're uninsured and unprivileged. So in this particular article, there's a table that was presented that showed the number of uninsured, and how it has increased. So during the past 10 years or so, between 2008 and 2013, there's been an abrupt decrease in the number of people that are uninsured because of the Obamacare that I mentioned, which went into effect. Well, the law was passed in 2010. It actually got blocked and blocked and blocked by the naysayers until it went into effect in 2014. So the rate continued to drop until 2017, when an increase was spotted. The recent increase from 2018 shows that we're indeed seeing a rise in the growth rate in terms of people living without health insurance. So when people don't have health insurance, what happens to them? Well, they get sick, they get ill, they can't go to work, and the worst case scenario is that they die. And when it comes to death due to lack of health insurance, according to the Institute of Medicine, an average of 18,314 Americans between the age of 25 and 64 years die annually due to lack of health insurance. Now, we're supposed to be the greatest country on earth, the wealthiest country on earth. There's some doubts about some of that, as expressed by some people lately. But we've got 18,000 people a year on average dying because they just don't have health insurance. They don't have access to the greatest healthcare system in the world, supposedly. So the high cost of health insurance is one of the reasons why people can't get access and can't buy health insurance. Around 73% of those who were uninsured in 2019 claimed that it was because of the high cost of health insurance. So people with income below the 200% of federal poverty level are at the highest risk of being uninsured. The premiums for family insurance has increased by about 55% over the last decade. Now, there's some other key facts about the uninsured population. The uninsured rate among children was about 5.6% in 2019, which is less than half the rate of the non-elderly population in 2019. In 2019, over 7 from 10 of the uninsured, 73% had at least one full-time worker. Again, it isn't lack of jobs in many cases that you can't buy health insurance. It's just that the health insurance costs too much. It is a for-profit system. The Canadian system is not a for-profit system. Other countries have health insurance for their population to make sure they're healthy. And it's not based on a for-profit system. It is a system that is based on the need that the population has. So what impacts the rate of uninsured people in the United States? It is widely believed that the government-sponsored policies represent the main factor of influencing health insurance rates, both in the US, but also in most other countries. Policies are established at the federal level about health insurance and about Medicaid and Medicare. And then from there, it spreads to the private sector and to the rest of the country and to other parts of the world. So with this in mind, the Affordable Care Act that President Obama put in place was very, very significant. As such, the most recent, most significant policy change was made in 2010 when it was impacted or when it was passed in the United States. And the Republicans, I must say, tried to stop it all along the way. And in fact, they took votes more than 13 times, maybe even more than that. I need to look that up. But every time they got a chance to block the Affordable Care Act, which is health insurance for Medicaid and people who are poor and uninsured and who are out of a job, they blocked it. And it finally went into effect, and it's been doing well ever since. The main goal of Obamacare, and it was interesting that people didn't want to call it Obamacare. They wanted to call it the Affordable Care Act. They didn't know it was the same thing. And there was people being interviewed back in 2014, 16, 18. When you asked them the question, are you in favor of Obamacare? No, I'm not in favor of Obamacare. Well, how about the Affordable Care Act? Well, yeah, I'm in favor of the Affordable Care Act, because they didn't know the difference. They're listening to the news media or wherever source they get their information from, and listening to the sound bites and really not understanding what's going on with both politics and the healthcare delivery system. And the system is complicated. It is complicated and it is flawed and it is difficult to understand. So the main goal of Obamacare was to create an efficient, effective overall healthcare solution to the problem that existed. Secondly, it was to positively influence how Americans get their health insurance. It offered Americans that were uninsured access to affordable insurance policies. Now, you had the private sector that had their insurance policies out there that cost lots and lots of money. But the Affordable Care Act introduced an insurance system whereby they could afford to buy that insurance. And I have known for years and years, since I've been in healthcare, especially in the community health center sector where I served, more than 15, 16 years in various healthcare facilities, I know and knew for a fact that people will pay out of pocket for their healthcare if indeed it is available and it is affordable, because the community health centers across this country are set up with a system that allows people to pay according to their ability. They allow them to participate in a sliding fee scale, which means based upon how much income you have, that's how much you have to pay for your primary care visit. And it goes anywhere from, in some cases, 0 to only $20, $50, maybe even $100, but not very expensive at all. But that's only if you go to the community health center system, which is America's healthcare system for the uninsured. And based upon my experience and knowledge and research, it provides great quality care, in some cases more quality than the private sector. Also, the Affordable Care Act was about granting people that dislike their current insurance an opportunity to select an affordable insurance. Also, it introduced a regulatory framework meant to ensure that both healthcare providers and the insurers were transparent and honest about their work. Now, the key words are transparent and honest. It is a shame that we live in this country in which there is a system, a healthcare delivery system, which we depend on for life, that has companies that may not be honest or transparent about the services that you're supposed to get. But that's a fact. It is really there. The small print is so small in some of the policies, you just don't even want to try and read it. But part of the Obamacare that went into effect made sure that the wording was larger, got rid of the small print on credit cards, actually, and on the insurance policies. It also gave small businesses access to government-sponsored incentives that, if they chose it, it offered health insurance plans for their employees. Small businesses have difficulty keeping employees unless they provide some incentives, some benefits. And one of the major benefits that the big companies provide is health insurance. And so small companies cannot provide health insurance before the Affordable Care Act. And so this allowed them to buy that insurance and allowed them to keep their employees long-term. So the big benefits for small business. Also, Obamacare completely reshaped the way healthcare providers and insurers provide their services. It created a streamlined process. It reduced overall spending of the health insurance and healthcare spending in the healthcare delivery system. So, additional information is such that we look at what has happened since 2016. What we have now is roughly 1 out of 10 Americans did not have access to health insurance. And now that has changed. There's a greater percentage of Americans have health insurance now as a result of the Affordable Care Act. So when it went into effect, approximately 39 million people benefited from Obamacare. Obamacare in combination with Medicare. And it was offered free and unrestricted access in many cases. So following the introduction of the Affordable Care Act, the White House report revealed that the price of health services rose a little bit, but it was based upon out-of-pocket expenses, which in some cases weren't there in the first place because people didn't have health insurance. So they weren't going in their pocket to spend any money for health insurance. They just weren't going to see the doctor. So recent research efforts revealed that the introduction of health insurance marketplace helped 7.8 million Americans purchase health insurance coverage. Now, people who were immigrants were not eligible for Obamacare, and they still aren't. Of course, there was arguments out there that said that, oh, the Obamacare is going to allow immigrants and people who weren't born in this country to use our healthcare system. Well, that's not the case. And again, from experience, the uninsured population, the undocumented people in this country, if they have an opportunity to pay for their health insurance, they do so. I have witnessed it in several of the health centers that I've ran. They will come with cash money and they will pay for their primary care services for their children, for their parents, for themselves. So for the past, before Affordable Care Act went into existence, and when I would talk to people, I would speak to the insurance companies that were in the room. I said that they are missing money. They're leaving money on the table by not offering an insurance policy and a plan that poor people could afford, because working poor collectively make a lot of money. They have a lot of money, and they will spend it on healthcare when they get sick. Now, it gets spent on a lot of things, mostly taking care of just security and maintaining daily existence. But there's a lot of money that can be spent on healthcare if the system allowed it. And until Affordable Care came into existence, that wasn't there. You just did without, or you end up in the emergency room, which is where a lot of healthcare takes place. And that created a problem for the healthcare delivery system, in that overall the system was burdened by people using the emergency rooms for their primary care needs. So many people have benefited from Obamacare. So let's see. Consequently, we all can conclude that the healthcare access was quite difficult for Americans who did not have health insurance and who had low wages. So now that we've got Obamacare, uninsured has dropped considerably, and many studies are undergoing and will continue to go on to look at the system to make sure that it is working well and that it continues to serve all of our people in this country, and mostly our working people who work every single day from dawn to dusk, taking care of all kinds of needs that the country has. This system, this Obamacare system, is now making available healthcare that they can afford. However, you know, we had the Trump administration for about 4 years history. And the entire time that he was there, he tried to dismantle this marvelous, wonderful, affordable care system that Obama had put in place. He, first of all, delayed the implementation. There were instructions that told you what to do, how to get it set up, and roll it out. The Trump administration delayed that and kept Americans from getting health insurance for a long, long time. They did not manage to scrap the program and to destroy the program. They just tried to stop it over and over and over, and there was bad press and lip service given to it. But it exists, it's thriving, and during the President administration under President Biden, they have expanded it a bit to make it even better. So, the healthcare delivery system in the United States, supposedly better than anywhere else, is a good system. Best quality care is given here, but there's still people, still citizens, still people who live in the United States who do not have access to healthcare because of the system and the way it works, and you gotta have money to access the healthcare system. So finally, I want to say that this thing has worked its way down to, there are certain states that have expanded the Obamacare, and so those states are doing well. Their population The people who have better health care, better outcomes as a result of having access to that care. And there's many states that do not have access to that. And so the people in those states aren't doing well. And you can imagine that it is well, you don't have to imagine, I can tell you, it is the southern states that have the poorest health care, because that is where they have the governors and the folk who did not want to expand Obamacare, and so its citizens are suffering and doing without. Texas holds the record for having the highest number of uninsured Americans in the United States. Texas, who has a Republican governor and who has been fighting Obamacare and other things for years and years. So at this point, a total of 79 million Americans have medical debt problems, even though they've got health insurance and they can pay for part of their care, and they still got health insurance. Debt, and debt is not good. So that's all I have time for today. This is Richard Brown, and I'll see you around.
This has been Your History and Health Comes First with Dr. Richard Brown. And you can leave suggestions at ewcfacts@gmail.com. That's ewcfacts@gmail.com. This has been an EWC Communication production.